So our center, our Pediatric Motility Lab, provides services to test, diagnose, and treat children with pediatric motility disorders. So pediatric motility disorders are disorders where the physiology of the GI tract, the way the GI tract moves, is affected. A lot of the children who are referred to us have had symptoms for a while, with maybe a stooling difficulty, feeding difficulty, abdominal bloating, abdominal distension, vomiting, swallowing problems. So there's a whole constellation of symptoms that they can present with. When things don't seem to get better, that is typically when I see these patients who are referred. I feel we're unique because we deal with children, and children are not just young adults. They grow, and we have to adapt to their needs, to their age, to their stage of development. And if they have special needs, we have to adapt and be able to accommodate for all those things. And I feel very honored and privileged because our center does that. And we also do it with a family-centered diagnostic and therapeutic plan where we involve the families in decision-making. So the treatment options, of course, depend on what the underlying problem is. We always have the medications that we can use, and one of the things we do during motility testing is check for the efficacy of the medication to see if this will work for the patient. And then if we feel that a patient may not respond to medication, surgical options come to the table. And if there is a functional problem, which means you have patient with symptoms, but motility is normal, there might be a psychological approach that can be employed. So the good news is patients don't have to feel lost anymore. I feel when they have had a workup and they haven't had the answers, there's better awareness about pediatric motility disorders and functional disorders in general. I think practitioners and providers are quicker to make the referral, which leads to early diagnosis, better therapeutic options, and better solutions.